Today on Hatching for Health.
As if needles are not scary enough for all of us, can you imagine a little child learning to put a needle into their own vein, be able to give them a medication to help them prevent blood clot?
So hemophilia, there's hemophilia A and hemophilia B. Basically, a bleeding disorder is when you are missing a protein out of your blood that prevents it from clotting.
So is Bo gone through any kind of traumatic injuries that have actually impacted him because of this?
Yes. So he was actually in the hospital for a day or two, and then the physical therapist from the treatment center saw him and.
Hi, I'm Jessica Hatch, inspiring hope, spotlighting rare battles, and uniting families. Today's guests are with Lone Star Blood Disorders. We actually have one of their directors, along with a mother of a child that is participating with their services here in Houston. So glad you guys came out.
Yeah, thanks for having us.
And you're based right here in Houston, Texas.
Yes, our chapter is based here in Houston, but we cover all the way across Austin, San Antonio, El Paso, and all the way down to the Valley. So we cover a lot of area.
Yeah, and I assume you live here locally in Houston?
Yes, we live in Houston.
Okay, and your son actually goes to one of the locations for his daily, or I don't know how often exactly, but treatments?
Right, well, he doesn't need to go somewhere you treat at home, but the foundation has been a support group and just meeting other families that are dealing with hemophilia or other bleeding disorders, and just it's information and seeing, how other people are addressing issues. And
of course. So tell me a little bit about who is, I guess, kind of a patient / candidate for connecting with you guys, because it's all related to different blood disorders.
Yes. So the two main bleeding disorders are hemophilia and von Willebrand's disease. They're usually diagnosed at birth. You are born with them. They're genetic, and you have them for your entire life. So what happens basically is they're diagnosed at a hospital, and then they are connected with the Hemophilia Treatment Center. And we're lucky to be in Houston with all the medical facilities here. There's 2. There's only 6 in the entire state of Texas, but there's 2 here in Houston. They usually are connected there. It's a very comprehensive model of care with hematologists and social workers, physical therapists, and they will connect the families, let them know that we're here on the support side, education, awareness, advocacy. To help kind of on the daily life. We don't do as much as the medical education, but the support side.
I see. So for those that are not familiar with these 2 conditions, kind of elaborate on what exactly the hema. I've heard that one more often.
Yes. Yeah, that is the more. So hemophilia, there's hemophilia A and hemophilia B. Basically, a bleeding disorder is when you are missing a protein out of your blood that prevents it from clotting. So if you cut yourself or you injure yourself, if you think about, I always try to explain it as like a domino train. You set up a domino train and you hit the first domino and it goes all the way to the end. You're injured. It goes all the way to the end and you make a clot. Our patients are missing one of those dominoes, one of their factor proteins in their blood. So when they're injured, that train stops partway and they continue to bleed into joints, into muscles, organs, things like that.
Wow. So it's when an injury occurs, they just don't have that kind of prevention mechanism that would slow it down.
Right.
They say you don't bleed faster, you just bleed longer. Mm-hmm. And it's really the internal bleeds you're concerned about. Because when you hear this, you think about, it's a cut and,
you're just bleeding out,
right.
Out of the
and it's
area.
really more internal bleeds.
When something happens that you don't see it.
Right. You twist your ankle, you hit your head on something,
Okay. And that's for anywhere in the body that would occur with someone with this condition, it will continue to bleed until it's addressed.
Right, and we have, treatment has come a long way, and I don't know, we might talk about that a little bit, but, a lot of our older guys, they had continual bleeds into joints. And so, they have so much joint damage because that blood pooled in the joint and ate away at the cartilage. So they just have bone on bone and they're not able to walk or, straighten their elbows all the way. It really impacted their mobility.
Was this prior to them learning about treatment options, or is this just something that actually happens regardless of treatment?
No, it was before. So today we are very, very thankful for some great research that's been done, and we have some great products. Most of our patients inject the missing clotting factor intravenously every 2 to 3 times a week. There's some other products that are there. They can do once a week, but it replaces that clotting factor. So it's just been a progress. Like back in the 60s, they used pure blood products or cryoprecipitate to treat bleeds. And this is a more recombinant product that they can use now.
You just used a lot of really big words that most medical professionals would have followed. So, okay. But basically what you're saying is like, rewind maybe 50 years ago, like you didn't probably have a life expectancy you do now. Is that safe to say?
Right. It was about 11 years old back 50, 60 years ago. Because there was just no treatment and not a lot of education either and awareness.
Yeah, were you aware of that?
I actually have no idea how they treated hemophilia 50 years ago because we just became fully aware of it 18 years ago when my son was born. But I don't know how they treated it.
And so your son's now 18 years old.
Right.
But at birth is when they're diagnosed. And so is he immediately like set up with this group or just kind of learning about the ins and outs of it? Right.
So you go through, the diagnosis with the medical professionals. And then when they did diagnose him with hemophilia, they introduced us to the group, which, it's a big, scary diagnosis to receive. And many people have family histories of it because it's genetic. We did not. And we were not familiar with it. But I remember the first time we went to an event with the chapter, and there are all these kids running around doing completely normal activities.
Yeah.
We were thought, are we going to have to, when he starts walking, well, we have to have pillows all around him the whole time and stuff. And so it was just very comforting to see these other kids leading completely normal lives. And the parents were not freaking out about everything they did. They were running around. I think it was at a bowling alley where we met them. And that was
great. The community of it and like just other like-minded, mothers and fathers that have like known and been diagnosed and they're, living,
living basically normal lives.
Yeah.
Right.
Yeah. We're a very, very tight community.
I just think the confidence that it gives those parents, with these treatment options being available. Because that shot you're talking about, like that actually, regardless of where the potential fall and bleed would happen, it's going
in
to
a vein.
Yeah, that's pretty.
It's in the vein, but it's a quick. Because I know when I would tell people it was an IV, they're thinking of a drip or something that takes a while, and it's just I don't want to call it a shot. That's probably not, but it's an injection into the vein, and it would take 10 minutes to mix it and
really,
infuse it. And so it became quite simple. It's a little scary at first to do that to your child, but it was very manageable.
And how often is it needing to be, injected?
So my son is on a product, because my son's 21 and has severe hemophilia. He's on a product that he takes 3 times a week. Okay. And our son is...
And my son's actually on a newer product that he just takes once a week, and it is an injectable. It's subcutaneous, not in the vein anymore. So that's been made it much easier. And he's away at college, and it's completely manageable.
Okay.
I think a lot of these boys, they just, it's from birth. So that's just normal life.
They're completely used to it.
They know, okay, this is what I have to do. I mean, they learn how to infuse themselves. It's a process when you learn, you go to the treatment center, they infuse, you have an injury, then you get connected with a home health care, a nurse will come to your house and do the infusions. They teach the parents how to do it, and then eventually the child learns to do it themselves.
Wow, where they're actually, the other one, when it's not the subcutaneous, but the one where they have to go into their own vein.
Yeah, my son learned at 7 years old.
Oh my goodness. Isn't that incredible?
Yeah.
And that's a lot through the chapter, teaching the kids how to infuse themselves on their own. And they do it at a very young age, and they see these other boys doing it, or boys or girls, and think that they can do it as well. And it gives them the confidence, and they make a big deal about it when they can do it themselves.
Yeah.
And
they get the big stick award at camp.
Yeah. I wonder, how many of these young men go on to medical professions because of kind of understanding something at such a young age.
Right.
So, you speak a lot boys. Is this something that a girl can be born with as well? Or is it predominantly boys? Like, is it just a combination?
So it's carried on the X chromosome. So a mother would pass her X chromosome to her son, and he has hemophilia. A girl can also carry the gene and have symptoms and have, moderate, mild, and even severe hemophilia and major issues as well.
Okay.
But it is carried on the X chromosome. So when a boy has one X chromosome that's affected, they don't have another one, a normal X to go along with it. But it is affected both boys and girls.
Okay.
So, for example, after my son was diagnosed, I was tested to see if I was a carrier, and I am, but I have no symptoms because my other X chromosome compensates.
Yeah, but then we have families that, the mom has the gene and has a lot of issues just as if,
Okay.
But it is predominantly boys.
Boys, okay.
It's thought of as affecting males, but there are females that have it as well.
Okay. And do you have other children?
I do. I have a daughter.
Okay.
And she does not have any symptoms.
Okay. Yeah. Okay. So there's that condition, and then the other one,
von Willebrand's disease.
Von Willebrand's.
Yes.
Okay.
So that's the one we're raising a lot of awareness the past couple of years. It is estimated that 1 to 2% of the population has von Willebrand's disease and is unaware.
Wow.
So we're doing a lot of education with doctors and school nurses and OB-GYNs to raise awareness of the symptoms that might show a bleeding disorder, to try to get those tests run more quickly. On average, it's about 16 years from onset of symptoms to be diagnosed. For women, especially with von Willebrand's disease.
Really?
Yeah. It's just not tested as commonly. Doctors just, don't go that direction.
Well, I was just sorry, I don't know as much about von Willebrand since we're impacted by the hemophilia, but von Willebrand you're born with also, correct? Okay.
Okay. And what are the symptoms that are affecting
Same thing,
someone's life?
bruising, nosebleeds, just heavy menstrual periods. We have girls who will have month-long periods, and that causes a lot of complications.
She gets extreme migraines, but a lot of the other symptoms, I've heard her talk about. So it's, I wonder if, So you're saying that it's usually not diagnosed until age 16, or?
Well, so for women. For women, and I think that stat has gotten a little bit better over the past few years, because our national organization has done a big campaign as well for women and diagnosis, but it has taken a long time to get there.
Yeah.
For those tests to be run sooner than.
Okay, well, we do have to take a quick commercial break, but when we come back, I want to talk about the locations and kind of being able to connect people to find you guys. So we'll be right back with you after this quick commercial break. So is Bo gone through any kind of traumatic injuries that have actually impacted him because of this?
Right, and he has had one bleed. We call them bleeds when you have an area affected. And he was in 3rd grade then, and it was a bleed to his hip, which is very unusual, and we still have no idea why it happened.
Hey, welcome to Infinity Diagnostic Center and Prestige Medical Pain Clinic. We are right here in the heart of Houston, inside the 610 Loop. We do interventional pain management and we do MRIs. Our MRI facility offers a 1.5 Tesla Siemens magnet. We can do MRIs of the brain, spine, any extremity, foot and ankle. We got you covered. Then we have our pain suite. So our pain suite is for when you do have that pain. You get the MRI, and now the doctor can sit and evaluate that MRI with you and look at exactly what's going on. And right here, they'll do an interventional pain injection, ESIs, transforaminal, a various amount. We've got 2 doctors on staff, so we got you covered. Before you actually get set up over here, you're gonna come to our consultation room, in which you will be visited with one of the specialists. And we're treating insurance, cash patients, Department of Labor, and personal injury, which is so important. So we can take care of all of those different needs. Just come see us here at Infinity Diagnostics and Prestige Medical Pain Clinic. Hey, welcome to Infinity Diagnostic Center and Prestige Medical Pain Clinic. We are right here in the heart of Houston, inside the 610 Loop. We do interventional pain management and we do MRIs. Our MRI facility offers a 1.5 Tesla Siemens magnet. We can do MRIs of the brain, spine, any extremity, foot and ankle. We got you covered. Then we have our pain suite. So our pain suite is for when you do have that pain. You get the MRI, and now the doctor can sit and evaluate that MRI with you and look at exactly what's going on. And right here, they'll do an interventional pain injection, ESIs, transforaminal, a various amount. We've got 2 doctors on staff, so we got you covered. Before you actually get set up over here, you're gonna come to our consultation room, in which you will be visited with one of the specialists. And we're treating insurance, cash patients, Department of Labor, and personal injury, which is so important. So we can take care of all of those different needs. Just come see us here at Infinity Diagnostics and Prestige Medical Pain Clinic. Welcome back from the break. If you have just joined us, we are talking to Lone Star Bleeding Disorders, and we are learning about the difficulties but also the ways that they can help with different bleeding disorders. So in talking about it, we were just discussing two, the Willebrands?
Von Willebrand's disease.
Von Willebrand's, and hemophilia. So both mouthfuls, but very manageable, treatable, which is, that's what's most important, right? I mean, being diagnosed with a scary condition is scary, but knowing that you can have a treatment for it as a mother, both mother, because you have a child being treated as well. So tell me about your two locations, because there's two in Houston that we were speaking of.
So there's two hemophilia treatment centers, and that's separate from our organization. Those are the clinics where our patients are diagnosed, they go for their treatment. Okay. We are the nonprofit that we work very closely with those clinics, providing educational programs and events, community events, support programs, and advocacy support for.
Because y'all are a foundation, so y'all like 501c3
yes.
where donations. Okay.
Yeah.
And then the locations themselves, what is the sign? Is it Lone Star Bleeding Disorders?
Lone Star Bleeding Disorders Foundation.
So that does say. Well, I mean, the two locations you would actually go for treatment?
Oh, no. It's so here in Houston, we have Gulf States Hemophilia Treatment Center. And then there is a hematology clinic tied into Texas Children's Hospital in the medical center. Okay.
And so if someone has been diagnosed, it sounds like they get connected like right away within the hospital system. But for those that might not, I mean, how would they find you guys?
They can look us up online. We have a website. We are on social media. Ask their hematologist. We work with not only the hematologists there at the treatment centers, there's independent hematologists that some patients choose to go to. Look us up online.
Yeah, so not difficult to be connected. And is your organization, is it across the U.S. or is it?
So we cover Houston. We cover the southern half of Texas: Houston, Austin, San Antonio, El Paso, all the way down to the valley.
So that name Lone Star is kind of
yes, part of that. So we cover that, and then there's chapters all across the country, just like us. And we work closely with the National Hemophilia Foundation and the Hemophilia Federation of America, which are two national nonprofits that support patients with bleeding disorders.
Okay. And now these are, it sounds like the two most prominent ones that are discussed and have obtained a lot of research, obviously, to be at the point they are with treatment. Is there other bleeding disorders that like aren't so common?
Yeah, there's factor 10, factor 7, different.
Quite a few. Yeah. But y'all, like your focus are the other two that like
those
people
are
come
the most
in.
common for sure.
Okay. You mentioned, so hematologists obviously being like, someone to diagnose, treat, physical therapy, like where does that actually fall into, one of these patients coming in and learning?
Right. So if, earlier we talked about the joint bleeds that, an injury and the joint just continues to bleed, it swells, it may cause damage to that joint. And so the patient would need to go see a physical therapist and have physical therapy to, improve the range of motion, get exercises that they can do at home to help support that joint.
Okay. Now what is your son's name?
Bo.
Bo? Oh, great name. I knew a Bo in high school. He was a cool guy. So is Bo gone through like any kind of like traumatic like injuries that have actually impacted him because of this?
Right, and he has had one bleed. We call them bleeds when you have an area affected. And he was in 3rd grade then, and it was a bleed to his hip, which is very unusual, and we still have no idea why it happened. And but that's the only time that he has had something like that.
And did it require physical therapy?
Yes. So he, he was actually in the hospital for a day or two, and then the physical therapist from the treatment center saw him, but he has full range of motion now with that hip. So it was excellent.
Just something. And I guess too with I don't know if that shot that he's now doing, I guess that's been available for as long as he's been alive, right? That's something that was already on the market. And was it always, I guess, an or subcutaneous? Like, is that a new option? Like being able to?
The subcutaneous is a fairly new option in the last few years. But, and I don't know how long the injectable. It was around when he was born 18 years ago, but I don't know when that become. Do you know when that became available? But that's the difference,
it being able to be done the other way. I mean, obviously you guys are great at teaching them through the vein, but it's pretty incredible that now it's even
Well, and the nice thing about it is those shots, once a week, 3 times a week, prevent really dangerous bleeding episodes. If they
Yeah.
didn't have that, I mean, they could wake up one morning and their ankles is this big around because they barely tweaked it the day before.
All go right there.
And they may not even remember, well, what did I do? Oh, maybe I did kind of tweak it. You know, it can be a very minor injury that we might not even notice. And they'd wake up, you know. So the nice thing about this medicine is they can give it prophylactically. So they can give it ahead of injuries and to prevent the injuries instead of waiting for an injury, waiting for the damage, and then infuse.
Yeah.
They can do it ahead of time.
So, I mean, would it be safe to say if they're, you know, doing either form of this, I guess considered a drug, are they pretty much in the clear for not having an episode where it would be like life?
You
know?
can still have breakthrough bleeds. I mean, anything can happen. I mean, we have had patients, you know, still have those breakthrough dangerous bleeds for whatever reason, but it drastically reduces the chances.
The chances.
Yeah.
Okay. As far as like sports and stuff are they supposed to avoid like, you know, high impact, like football?
No football,
or?
which is hard in Texas.
That's what I was going to say. I was
gonna say,
like,
when we
that was
received
a hard
the
one.
diagnosis, that I remember the doctor saying to us, he will lead a completely normal life. He just can't play football
Yeah.
or wrestle.
Right. Right.
Okay.
Yeah.
So
My
they're-
son played baseball through high school.
okay,
He
yeah,
was
'cause it's
good,
not something
you know.
you're supposed to run.
Right. Right. So we would just infuse and
Yeah. Yeah, and Bo did baseball when he was younger, but then he really became a runner.
Okay.
And swimmer.
Okay.
Those were excellent for his joints.
Yeah. So that's the great thing. These patients can be normal, you know, do what they want to do.
Yeah.
With, you know, without football.
Except for, yeah.
Yeah.
And so if, like I know it's very common nowadays for couples to go get tested, like for their genetics to find out like, you know, is there something that we, you know, chromosomally are going to create together that we need to look into. So even if like you had done that, you know, because really just one has to be a carrier, not mom and dad, just one. I mean, there's not anything that prevents you from continuing on to have, you know, those children essentially, because it's not something that, you know, is life limiting. You know, it definitely has.
Right. So I have a younger daughter who, once you get past the initial diagnosis and realize that this is manageable, yeah, you can, you know, families have more kids and go on with life.
You'll meet families with three
Yeah.
sons with
Yeah.
hemophilia.
Really?
So
They're like, you know, helping each other. You're like,
Right.
here you go. That's,
Yeah.
And do you guys have like an annual event that
do.
people can participate in? Or?
We do. We have several. So
Really? Okay.
coming up in June, we have our Texas Bleeding Disorders Conference. We partner with the Dallas chapter, and we bring about 800 people in for a weekend conference of education. Our industry partners come in with all of their products and resources that they have available. Patients can learn about the different treatment options. We have sessions all weekend long for the kids to learn about how to manage their disorder, for the parents, for spouses, and then we have a camp for boys with hemophilia, and that's where they learn to infuse. And then we have different support groups, and we have a big walk in the fall, our big fundraiser. We have one here in Houston and one in the Hill Country area.
Okay.
So it's a really fun day for our families and anybody to come out and just have a good time and support a good cause.
For sure. Is there very many other organizations like yours, you know, kind of invested in the, you know, the treatment and the help that y'all are providing, or are y'all pretty much the only one?
For bleeding disorders, we're it.
Really?
Yeah.
well, we're the only one in Houston.
In Houston, yeah.
There's some
yeah.
other chapters and other, as she mentioned, there's one in Dallas. And
Yeah, most all the states have at least one chapter in them as well. But
and then y'all
we're
just
for
connect
here.
with each other for the support,
Yeah.
you know,
Yep.
if someone lives there and
Right.
can connect them. Okay.
Yep.
And are the two locations, are they like staffed with hematologists, like on a, like they literally work just for the Lone
Yes.
Star Bleeding? Okay.
Well, they don't work for us. They work for the hospital system.
Oh, okay.
But yes, they are.
But they're dedicated
they're
to, like,
dedicated
those
to bleeding
offices.
disorders.
Okay, that is great. Is there any advice, Jennifer, that, you know, or really either of you, I keep thinking, you know, I'm like, you're with the organization, but also a parent of it. I guess really just for the both of you that you know, starting with you, Jennifer, that you could maybe give others that have, you know, maybe just learned that that's been a diagnosis of their child.
yes, and it, you know, I think as we discussed earlier, it is a scary diagnosis to receive. Many people have a history in their family, so it's not a surprise. But if it's the first family member to have hemophilia or von Willebrand's, it can be a scary diagnosis. And I think the chapter just really does a great job of putting it into perspective that this is something very manageable. And I just remember when, you know, my son was growing up, when he was little, really, you know, all the earaches and fevers and stuff affected his young life more than the hemophilia did, just the
Yeah.
normal kid stuff. The hemophilia was very manageable.
Okay,
And that's thank
that's
you
good to
to the
hear.
doctors and the support the chapter provides. And
Yeah, all the education and stuff that they give, the community that y'all have created there, and you as well. I mean, obviously you found a home working in an organization to support. So obviously it's been very impactful in your life in a lot of ways. But any advice you would just have for those that are listening?
Just don't panic at the beginning. You want to. I know you want to because I've been there. But just reach out. There's so many people in our organization that's here to help.
Absolutely. Well, I really appreciate both of you guys being on
Thanks for having us.
and just kind of helping us to understand these conditions, because it was something that was kind of a blur to me. So now I understand and can point people in your direction.
Yeah, thanks.
So,
Thank you.
Thank you.
And thank you all for tuning in to another episode of Hatching for Health. We'll see you right back here next Saturday. Hey, welcome to Infinity Diagnostic Center and Prestige Medical Pain Clinic. We are right here in the heart of Houston, inside the 610 Loop. We do interventional pain management and we do MRIs. Our MRI facility offers a 1.5 Tesla Siemens magnet. We can do MRIs of the brain, spine, any extremity, foot and ankle. We got you covered. Then we have our pain suite. So our pain suite is for when you do have that pain. You get the MRI and now the doctor can sit and evaluate that MRI with you and look at exactly what's going on. And right here, they'll do an interventional pain injection, ESIs, transforaminal, a various amount. We've got 2 doctors on staff, so we got you covered. Before you actually get set up over here, you're gonna come to our consultation room in which you will be visited with one of the specialists. And we're treating insurance, cash patients, Department of Labor, and personal injury, which is so important. So we can take care of all of those different needs. Just come see us here at Infinity Diagnostics and Prestige Medical Pain Clinic.